بسم الله الرحمن الرحيم. Coronary artery bypass grafting. In such procedures, we have to discuss extracorporeal circulation by heart-lung machine. Open heart surgery should be achieved in bloodless and motionless field. Components of heart-lung machine: reservoir to collect or return venous blood, oxygenator for oxygenating deoxygenated blood. It could be bubble or membrane oxygenator. Roller pump used to push the blood back to the arch of the aorta. Heater cooler used to cool down the temperature of the patient during bypass and warm him up at the end of the bypass surgery. Such picture showing the machine, oxygenator, pumps, arterial pump, vent to suck the blood from inside the heart, suction to suck the blood from outside the heart. Simplified picture for the heart-lung machine. Let's go on pump. Blood was drained from both vena cava to the reservoir, then to the oxygenator to be oxygenated and to be turned again to the body using the pump to the arch of the aorta. Steps of the procedures. Mid-sternotomy done, which gives good access to the heart and big vessels. Heparin is given to the patient before cannulation. Cannula are inserted into the aortic arch, superior vena cava and inferior vena cava. The oxygenated blood is returned from the oxygenator using the roller pump to the patient through the cannula placed in the ascending aorta. Aortic cross clamp applied at the ascending aorta, causing global ischemia and force the heart to stop beating. Cardioplegic solution is delivered through the aortic root. Myocardial preservation. When I stop the heart, I have to preserve the myocardium. Cold 4 degrees centigrade cardioplegic solution containing potassium chloride infused into aortic root or directly into the coronary ostia. Example cases with aortic regurg or retrograde through the coronary sinus in cases of left main coronary artery disease. يبقى الكارديوبليجيا عندي 3 طرق بديها بيها. aortic root to the coronary ostia، لان انا لو اديتها في الاورتيك روت وفي aortic regurg مش هتهولد الكارديوبليجيا وهتروح على left side of the heart، او through the coronary sinus in case of left coronary artery disease. Left main. Protamine sulfate is given to neutralize heparin at the end of the operation after removal of the cannula from the heart. Complications of extracorporeal circulation: cerebral stroke and neurogenic defects, bleeding complications secondary to platelet dysfunction, renal insufficiency, pulmonary insufficiency, lung atelectasis, adult respiratory distress syndrome, post-perfusion lung, cardiac complications such as perioperative myocardial infarction, low cardiac output syndrome, stone heart syndrome due to bad myocardial preservation and arrhythmia, gastrointestinal complications such as ileus, stress ulcer, and acute pancreatitis. Ischemic heart disease. When we talk about ischemic heart disease, we have to know anatomy of coronaries. Left coronary system and right coronary. Left main coronary divided to left CX and left anterior descending with diagonal branches, and the circumflex is divided to obtuse marginal branches, and right coronary is divided into posterolateral branch and posterior descending artery, venous drainage through great cardiac vein. Investigation of ischemic heart disease: chest X-ray, EKG, resting and stress, cardiac enzymes, coronary angiography, echocardiography. Coronary angiography to detect the site of obstruction in coronaries as we see in picture. Right coronary. CT coronary angiography, echocardiography, Colored Doppler, CABG versus BCI, left main stem coronary stenosis or left main equivalent, three vessel disease, in-stent stenosis or thrombosis after BCI, ischemic heart in diabetic patients, combined CABG and valve surgery. So we have to proceed for CABG procedure. Patient should proceed to surgery. No PCI in such cases. CABG is done through midline sternotomy. We have to harvest conduits used left internal mammary artery and saphenous vein from the leg. Heparinization, cannulation. Such picture during harvesting of skeletonized internal thoracic artery, left internal thoracic artery, or lima, left internal mammary artery. Cross clamping and cardioplegia. Distal anastomosis on the heart is done. Declamping and proximal. Weaning of pump and reversal of heparin. Picture after surgery. Left internal mammary artery, the left anterior descending, vein graft on the right. OPCAP or off pump coronary artery bypass grafting. Such operation done while the heart is beating. But as we see in picture, we use something called octopus for myocardial stabilization. Intracoronary shunts. These are double limb shunts that fit into the proximal and distal ends of the open coronary artery, used during OPCAP procedure or off-pump coronary artery bypass grafting. Thank you.